Hey, Dinks. It's another podcast episode, and I'm lucky today to be joining Dr. Nacho Goodman of the very famous, influential group, Nachos, Dental Nachos. I wear my swag a fair amount around town, and I do get asked a lot about my sweatshirt from non-dental people. So apparently the swag is incredibly effective. Paul, thanks so much for joining us today to have a conversation about education and the future of dentists.
I appreciate that. I'll give you one good tip that'll help you, because when you do wear nacho swag, and if you name your company after an appetizer, you have to expect this. I was walking on Broad Street in Philadelphia and someone shouted out at me from behind me, "Hey, you." And if you've been to Philadelphia, I've lived your whole life, you gotta be ready for anything. Disgruntled Eagles fan, tourist. I turn around and I see like a 50-ish-year-old woman, and she said, "What is dental nachos?" And I said, "That's a great question. A lot of people ask me that. Dental nachos is like a Mr. Rogers neighborhood for dentists to learn about business, supporting each other, being nice to each other." Believe it or not, dentists are incredibly nice to patients, but they sometimes have a hard time being nice to each other. So we help them do that along with learn with the business. So that's like a 3-sentence answer, because people will ask you that. What is dental nachos when you wear the swag?
That's fantastic. I think my next poll on our Facebook group is going to be, do we switch our name to Dental Calamari?
I like that. Yeah. Food is bonded together.
Yeah, exactly. Or maybe we're Dental Dirty Martini. Like, that's probably more our vibe.
I also want to be clear, and it was very kind to say, maybe Dental Nachos is famous in the dental world, but not real person famous. But we moved into Philadelphia. I was with my wife, Mrs. Nacho. She loves that name. Doors open on a Saturday night, and these three young people there, and 2 of them go, "Oh my gosh, it's Dr. Nacho. He's here. He lives here," all this stuff. And they were going crazy. They were really super nice. And the third friend they were with, right, who wasn't a dentist, goes, "Are you famous?" I go, "Not real person famous, maybe dentist." They were dental students, and they were so nice. And my wife and I laughed. So
we're all famous in a sphere, right? Depending on the sphere you're operating in.
My goal, just like you guys, is we can be serious about helping people. We don't have to take ourselves so seriously. I learned that from my amazing dad, who I worked with for many years. So that's my goal, is to kind of infuse a little more fun and friendship into the dental world.
I think that's excellent. And I think, to your point, we don't do that enough. We are not always super kind to each other. And maybe it's just an outlet of our own general frustration with the profession. And then we just take it out on our unconditional loved colleagues that hang out with us all the time. So, and speaking of that, I think it brings up an interesting segue to talk about dental education and what some of these stressors and compressions are on our young grads that are coming out into the profession. You talk a lot to young grads. You help find jobs for them through Dentist Job Connect, but also help support them in their new journey through Dental Nachos. And I'm curious, from your bird's eye view, what are some of the challenges that these young grads are currently facing?
I mean, it's a great question. I think one of the stories I'll kind of tell, just to kind of kick this off, is for a period of time when I was single, after my girlfriend from dental school and I had broken up, I would walk around at like 29 years old, and a lot of people would say, "Why are you single? You seem normal, and it's not so hard to meet people." And I wanted to be like, it felt like being single was a disease. That was my book, and I kind of was getting this well-intentioned but gaslighting advice from 50-year-olds. I'm like, "Oh, when did you date someone last? 2 decades ago? Was that when you dated last?" So maybe it's a little different now. And while you're well-intentioned, saying everything's going to be fine or you don't have it so bad, that type of feedback can be really frustrating to people going through challenges. So I think that we have to embrace that the dental world is markedly different than when I graduated 20 years ago, okay? Markedly different. And there are factors that are influencing the business, the lifestyle, the fulfillment of dentists that are really threatening the industry. I talk about the D's of, dental school debt, dental insurance, DSOs, and each one of these come with some good points and challenging points. It doesn't mean that they're all bad, but the downward pressure on dentist income and the skyrocketing cost of dental school. I don't know if you invited a high-level economist here on the show with you here, Jennifer, but I don't know if I'm Alan Greenspan, but if a job is paying less and it costs more to get that job, it is going to be a frustrating experience for people out there. I'll share, even Mrs. Nacho, my wife, was a wonderful teacher for many years. And she said to me in a poignant way, I kind of wish someone told me the reality of teaching. I think I had like a more romantic notion of it from my grandmother. And, I'm in an inner city school district and they're paying us less and they're freezing our wages and have to work harder. And it's just really demoralizing. This is someone as a teacher. And maybe if I wasn't married to a teacher, I wouldn't understand. But since have an inbox full with dentists sharing their story with me on an everyday basis, the rewards and challenges, my hope is that I can bridge the gap between the 50-plus-year-old dentists who say there's no problem, but they've been married for 20 years, they've had a practice for 20 years, and the newer dentist who, right off the bat, some insurance companies are paying them less than you and I, Jennifer. I mean, right there. How do we feel about that? You do a filling, I do a filling, new grad does a filling, they pay that new grad less forever than us.
Yeah, and you talk about that point a lot, and I find that an interesting argument because I could go on both sides of that coin and say, as a experienced dentist, I also find it demoralizing to show up and do, with fellowships and academies and graduations and get compensated, and not based on insurance opportunities, but basically the value of the service is the same. If you have DDS or DMD after your name and you sit down and you provide a service, the value of that service is the same. And I think we have demoralized young grads coming out because they can't earn the income that they're hoping because of these fee capitations that are happening from the insurance plan. You also have demoralized mid-career doctors who are saying, look, I've achieved, I've earned, I've learned, I've grown as doctors, and yet I'm still being paid the same as what I was being paid when I sat down and did a class 2 fresh out of dental school. And I assure you, it's a better composite today than it was 15, 20 years ago.
I love that point. And I'm holding up, I don't know if you're from New Jersey, but there's a lot of Bed Bath & Beyonds in New Jersey.
Right?
The 20% off coupon. And it's because we have, and I've been part of this, I've contributed to this challenge too. I was in network with dental insurance for 15 years. Over the last 8 months, I'm now totally out of network. That comes with stress. That comes with challenges. I'm glad I've done it. It's a right time for us in our practice. But when we sign up to let someone control what we can charge people, we have a lot of problems. This does not exist in the haircut industry, right? You can charge $800 for a haircut, and if someone pays it, great. There's no haircut PPO. You've seen me do videos on this. I want to share more about that dental insurance thing just so I share the full context. I'm saying newer grads are getting paid less, but if you and I signed up for those plans, we would be getting paid less too. It's really anyone who signs up new to the plan. So your point about skill level is a good one, but I want to make sure I'm clearly explaining this. It affects new grads the most because they are the ones graduating and signing up for Spoiled Block PPO. But if tomorrow you felt you were in Massachusetts and you wanted to sign up for this Spoiled Block PPO plan 20 years in your career, they would pay you less than a dentist who's been in network for 5 years. It was 2017. I will never forget it. I opened up an envelope from Spoiled Block PPO and they said, "Hi, Dr. Paul, Dr. Jeff, we know you've been in network with Spoiled Block PPO for decades. We're going to pay you less. Deal with it." And as soon as I opened it up, I knew that was going to be a problem. And I tried to deal with it because I was just a typical dentist. They said, "Okay, I guess we're going to see what deal with it." And just in that moment, Jennifer, to give context in our practice, it was $100,000 immediate loss for the next year because we brought in like $600,000 with this insurance and they just sort of chopped it off by like 15%. There was nothing we could do, like extra calories in your food. And then on top of that, I hired a new associate from a GPR. We'll talk about that. And they said, well, she now cannot be in the best Spoiled Block PPO plan. So I said, let me try to deal with that. And I strived. We had the patient relationships. And if I could go back in time to that moment, I wish I ended my relationship as an in-network provider with that Spoiled Block PPO. Over those 5 years, it cost me morale and money. And I wish I said, I am going to end this relationship and I will accept it as an out-of-network provider. So that helps you with the story. It's not easy to make these decisions, even for mature, medium-aged dentists like us who've had practices, because you have the same fear. Patients are going to leave. What is going to happen? My team's going to, one thing I can just share right off the bat, if someone's saying, what's the challenge of going out of network when you have to take a lot of plans? You don't need to be open as many days. And then what happens to your team? Do you pay them for not being there?
Yeah, these are all really unique challenges. And I think you bring up an interesting point Two, about owner docs that are looking to bring in associates. If they haven't done their homework on their current fee schedules being offered by the companies that they currently participate in, it's actually an unfair assessment to really know what an associate could earn in their practice, because you bring up an exact point that they likely won't be included in the same fee schedule. And so, if I'm doing the math to decide, is my practice ready to bring on an associate, I'm basing that on current fee schedules of what we're being compensated on certain procedures. But the reality is, most new grads coming in, or even non-associate docs that move into your practice, unless they've been credentialed by that insurance company prior, will not get the same older fee schedule that was available to perhaps you when you opened.
And my guess, Jennifer, I don't know, but my guess, and I don't want to get in trouble. Everyone goes, dentists can't collude on fees. I go, no worries. We can't even show up at the same free Zoom meeting at the same time. We got no shot on showing up at the illegal meeting. They go, why don't we all drop at the same time? I go, well, one, that's illegal, and two, we can't agree on anything, right? We can't agree. So, right. But my guess here, I have no insider knowledge of this. My guess is that they're just doing this so that they will get everybody on the lowest fee schedule. And once they get the people on the lower fee schedule, they won't need the older ones. My guess, is that's what's happening. And I think what's really poignant is that I always hear, when you're an entrepreneur or business owner, your job is to keep the company in business, keep the dental office in business. You can't help any patients if you're not in business. You can't help people further if you're not in business. So as the leader, when you're making these decisions, they're so difficult. So if you hire an associate who's paid 20% less by a dental insurance company, and there's no profit in that care, it becomes a vulnerability of the business where that's the fact, and the feelings are tough. And people said, what's dental insurance doing to your industry? It's contaminating the bond, because I saw Chad before. I know he likes bonding and cementing. Yes. That's what that's, right? We're going to talk about bonding and cementing yet less. Now everyone will tune. It's contaminating the bond between patients and dentists. And now dental insurance is contaminating the bond between practice owners and future associates.
So where do you think we go from here? I mean, you're interviewing and talking to young docs looking for jobs every day. Number one, what are the types of jobs that they're most attracted to and they're really trying to find? And is there anything that private practices can do to better position themselves to be attractive to young associates who are looking for work?
Yeah, both really good questions. I mean, I've done a lot of always struggling with, the staying in shape with dad bod stuff. So I'll just use myself as an example. And I have a good image, but I'm just saying, just use this as an easy, fun example. I've joined gyms, I've joined fitness programs with the goal of looking better on the beach. I've joined gyms or fitness programs saying, I want to lose 10 pounds before my next lecture. But those aren't really good long-term goals. So when you go to a good place, they say, we have to do an assessment of your total body fitness, where you are, Paul, and we got to pull back and say, let's do one of those body composition things that say your muscle density is great, but your body fat's not, just as an example. So I think what we need to apply this over here to dentistry is we need full awareness, JBR, Jennifer Bell, be real, right? I say, just be real.
There you go.
What's happening? Dentists, for some reason, for people who consider themselves scientists, get very emotional over facts, right? And they run away from facts and say, just help me, get my six pack for the beach. I say, that's not what you need long-term. So from the job seeker, understanding how dental insurance works, in or out of network, is incredibly important. So you can explain it to your patients, so you see how it can contribute to care when it works well, or prevent good care from being done when it doesn't, right? Because I'll just use this quick example. You get an fender bender, you take your car to the person who's going to fix it, and your insurance doesn't cover what the mechanic thinks, you think your mechanic's lying, right? Your mechanic could be like, no, Paul and Jennifer, they're the ones causing the problem. They're being cheap. If I don't fix this Johnson rod, that's from Seinfeld, your car's not going to be right. But since we have this insurance, the insurance is telling my mechanic what to do. So that's the same thing in dentistry. You and I have looked at a patient, talked about a night guard, and when their insurance doesn't cover it, they lose trust in us. They lose trust in us, no matter what we say. So as a new grad, I think you have to know how dental insurance really works, and you have to really ask questions about the relationship of that practice with dental insurances. I'll explain more. Too often, new grads desperate for jobs, which I totally get, just say yes and don't ask enough questions. And they're in the job, Jennifer, you're working for me. And I say, I do the crowns on our out-of-network patients here, but you get to do spoiled block. We have so many of those crowns, Jennifer, and my fee is $1,100. And then you look at spoiled block and it reduces it down to $600. And now you're trying to make 33% of like $500 after a lab bill. So ask good questions. I often use dental insurance, the word coupon, but back in fitness, it's kind of like processed food, right? I eat Doritos, doesn't mean they're terrible, but if I only ate Doritos, that would be terrible. So ask, as a new grad, really ask, what are the relationships in this practice with dental insurance? Make sure they show you contracts. I mean, in a self-interested way, we have a course coming up soon on this, but our goal is to just share. We have a totally fee-for-service dentist. I had dinner with him last night, Dr. Todd Fleischman. He makes people pay ahead of time. He inherited a practice like this. It's so fee-for-service, okay? Then you have me, I'm out of network. But if you come for your cleaning, Jennifer, I don't make you pay $187. I say, when your insurance pays, you can pay the difference. If the service is $190 and they cover $130, you pay $60. So I'm out of network. And then we have Dr. Travis Campbell, who's in network with 47 PPOs. And I think both practice owners and associates need to really understand how this works. Practice owners have to really identify, Jennifer, do they need an associate or do they want an associate? Do they need one or do they want one? Because if you just want one and you're in network with a lot of dental insurance companies, you're likely going to mess up multiple people's lives, yourself and the associate. Because there's often, when you reduce your fees and you don't need an associate, and then you have another dentist taking lower fees, it winds up dragging down the whole profit of the practice.
Do you believe that owner docs often need to have a salary readjustment for the entry time period in which they're bringing associates in? Is that part of the, and I speak from my own experience in saying, in order to ramp up this new person into our practice, and that may mean investment in education for new technologies they're not familiar with.
It's patient relationships. It's also recognizing this. You could be a 3-dentist practice. If you're adding on another dentist who's going to eat from your production, pretend it's pizza, they got to start eating some of your pizza or they're not going to be there. So I was just talking with a friend last night. He's saying, I'm distributing my work to the associate. This does allow me to work on admin. This does allow me to do other stuff. This does allow me to have say, but it costs me money. So, we do Dentist Job Connect, and we're proud to be sponsors of your group, and I love that. When I have Serena, our success coordinator, they say, Paul, they need to talk to you about, they need an associate. I say, well, you ask them a few questions first. Are you okay if you hire an associate and they work for you for a year and you make less money than you did the previous year? Yes or no? If they say no, I say, we don't have to have any further discussions. Don't hire an associate. If they say, sure, Paul, I make $627,000 a year. And if I make 500, I'd be thrilled, because if I can get some breathing room and I can get some not checking 3 hygienist room and I can spend a little more time with the kids, well, I say, well, now this is a good conversation, because now you do have that extra production for an associate. So I think mindset readjustment on the money that they make when you add an associate. This can have a happy ending, Jennifer, of making more later, but you really need to invest in mentoring, like you said, the technology, the speed. I know we're going to talk about it, but if you're a high-level stylist, Jennifer, and I'm a high-level stylist for hair, when we've been doing it for 20 years, and we hire someone from stylist school that didn't really learn, well, they're not going to be as good as us when they get there, and that's okay, because they didn't have the experience and the training. And that's one of my biggest problems with dental school. They're pushing people out into the real world, charging them full fee for this crazy expensive degree, and not delivering them the skills that they need to pay back these loans.
So let's talk about that, because you graduated roughly 20 years ago. Is that
2002?
Yeah, I was 07. And just in general, watching the trajectory of both the cost of the investment into the education, which I can tell you just anecdotally from my dental school, it's 3x what I spent just 15 years ago. That's just the tuition piece. Obviously, that doesn't include living expenses, et cetera. But I'm not convinced yet that the ROI on that education is the same. And obviously, COVID really threw a wrench into that piece as well. From your perspective, and talking to lots of young grads coming out, number one, do they feel that they maybe have received a less superior education, or like maybe are missing some very instrumental pieces to the puzzle that they're going to have to go pay to seek out? And two, is that affecting their ability to work and return their payments back on their loans?
I mean, two answers. For the first one, yes, we just had an anonymous post on Dental Nachos that said, I feel like my first year in practice is my fourth year at dental school, and it's really not going well. I feel like what I'm doing in private practice is the stuff that dental school should have given me experience on. What's totally nacho nuts is the learning experience in dental school is pathetically terrible based on this. All of us got experience based on this factor, Jennifer, right? Dumb luck. Did your patients need a lot of crowns? Well, you got a lot of crowns. Oh, did your patients have good teeth? Well, now you're upset. Me, I had the opportunity to do a significant amount of crowns, but for whatever reason, my patient base didn't need a lot of simple op, and it bothered me my whole career, right? That's why I always joke about class twos. I did so few, the bare minimum of class ones and class twos and class threes. I did do a GPR multi-year, but the GPR winds up focusing a little more on surgery and implants. So I always kind of had this missing link of simple op, right? Because dumb luck meant I got more crowns. I'm prepping a crown, that's no big deal. I did that 27 times in dental school. So one of the things that's crazy is we got more experience and paid less 20 years ago and 15 years. Now they're paying more for fewer clinical procedures. So there's like a simple answer to this. If you don't have enough pizza for people at your party, Jennifer, you know what you do? Invite less people to your party and just let them have the pizza. So they could just take less students, fewer students, but they don't do that because it's about money. So what they do is they pretend to our newest colleagues that this experience is okay. And then they find out now when we talk in the real world that it's not okay and that they don't have the skills. The paying back of the loans, and you guys should most definitely connect with my sponsor, Student Loan Planner, for a deeper dive on this. In some crazy mixed up world, you only have to pay like 10% of their income. So if they make like 120 grand, they only have to pay 12 grand. But I just was on with Dr. Mark Costas, who's one of my favorite people, and I just love talking to him. So he's part of DSI, and he has all these high level dentists in there. Jeff and I, you don't even have to be high level. That's not even great. Just people really committed to doing better. And so he has these masterminds. And he's like, Paul, I'm hearing this crazy thing from my, mastermind people, because these are dentists that often own more than one practice or often have a big practice. They're saying, my associate is telling me I can't do too much work because if I make too much money, it's going to mess up my loan repayment. And then you have all these owners being like, what the heck? This is what you came here for, right? And so that's another problem too. They say, oh, here, take over this practice, make $250,000 a year. And they go, I can't make more than 170 because of my loan. So they really have the cost of dental school. And that's why I was inspired by our messaging early this morning. I said, is the high cost of dental school hurting the future of private practice? I've texted out thousands of people. I did it on Nachos. 95% of people have said yes, because this high cost of dental school is causing new dentists to think they can't work in private practice. It's having private practice dentists not have enough seats at the table to take on associates. And it's leaving this huge opening for the consolidation of dentistry through corporate groups.
Well, and we're not even mentioning the fact that 5 new schools go online every 15 minutes. That's assuming the same number of schools, same number of grads, and we have a problem. And then you look at the last 3 years and the number of new schools that have gone online, flooding the market with additional competition, also all looking to pay off their loans and get jobs.
I want, Jennifer, you guys to do a podcast on dental schools used to go out of business, Fairleigh Dickinson, Georgetown, Bob D's school. So there must have been a different economics where if the dental school, like a real business, didn't make enough money, they would go out of business. But now the dental school's like, you don't have enough money. The government's like, no problem. Here's some more money, right? So it's creating this. The fact, and the one thing we'll share, so before someone shouts through their car speakers, access to care, this is nonsensical, because when you can't make, I was at the ODA, I was the keynote speaker in Ohio, and I was listening before me, they're trying to, I think it's going to get passed, they're opening up a new dental school in Ohio, and everyone's saying access to care, but you can't make the grads work in the areas that need access. It's still the US, right? So they're not solving this problem they're pretending to solve, because they get a degree, and like everybody, they're not necessarily going to work in some area where they need dentists. So it's just saturating the areas where there are a lot of dentists congregating.
I think two excellent points you've made. One, I mean, North Carolina is a very popular state. We're one of the top 2 or 3 fastest growing states in the country. That's where I happen to live. So there's an influx of doctors coming in, getting credentialed every day, wanting to get their dental license here in the state, on top of those who we graduate and who take our boards. And we still have counties that do not have doctors. So it's not a function of the volume of people who have the ability to do the service. It's, do they want to live in those communities? Do they want to raise their families in those particular locales? And that's not a right or wrong. It's just, if they're not heavily invested or don't have family in those areas are very remote and lack oftentimes quality education, access to services, healthcare, access to the theater, or, certain other individuals that might share similar socioeconomic statuses and education status, et cetera, that you might enjoy as.
It's true. When I started Dental Nachos in basically 2017, the Facebook group, 2018, where this, there was a D1 at a school near me she's amazing. She came to all my events. She paid attention. She just was fantastic. And she just messaged me and she's like, I'm in a very low populated area doing dentistry. I'm making over $250,000 a year. I do have fairly good mentorship, and I need to leave, Paul, because I can't live my life here. So she went out and did it. I mean, she did 3 full years. She made money, but she's not saying I want to stay there. And I don't blame her. She's like, I need to come back to the East Coast. It's lonely, it's isolating, it's depressing to be here. And one of the things, I know your viewers can't see, but I love this these ahas. I want them to sponsor me. So my aha moment the other day, just to fuse this in here, is we talk about the dental schools and the high cost, Jennifer, but there's a dental school, I'll just leave it nameless for now, that has branded their clinic with XYZ DSO, okay? They've taken money from one of the biggest DSOs and put it in front of a pre-clinic so the students walk by it every day. And one of the students who sent it to me had a good point. And Mark Costas and I talked about it because I posted on Instagram. This dental school is almost $100,000 a year. Why do they need more money? Why can't they do it with their $100,000 a year tuition? If patients came in, Jennifer, we were sucking on lemons and eating sugar and telling people to take care of their teeth, we would be hypocrites. So these dental schools are saying, just treat people right. We don't need to teach you about money, just treat them right. And then they're turning around with their hands out, accepting huge donations from spoiled guac PPOs and dental insurances, and they're getting $100,000 in tuition.
And it doesn't set them up. I mean, you talk about too, should dentists be educated on how to read a P&L and how to talk to their accountant and need to do all that. And I am in full support of that. I think that's a much needed area in dental school. And yet we're honestly setting them up for failure because we're already artificially inflating the idea of what the cost and ROI of being a dentist really looks like. I mean, if they see that they're getting all this influx of cash into a dental school and it costs you $100,000 to also attend the dental school to serve an underserved population who's not even paying full fee, any average dentist is going to go, this doesn't make sense. Right. And then how do I apply the business principles that have only been shown in an actual private practice that then does actually have to make money in order to stay open?
That's what I said this a while ago, and I mean, if you listen, I said this on one of my emails recently, and this is the theme of our conference: patient-centered care first, profit 1A. Patient-centered care first, profit right underneath it. And dental school, I will give them credit in this moment. I feel like they do focus on patient-centered care, right? For all their problems, I do feel like they focus on it. But profit in teaching them is so far behind that they mess up people's lives. If you practice the way you did in dental school, your office would go out of business in a week. One bite rim visit, just look at the bite rim. Don't put it in the patient's mouth. We were taking 8 visits to do stuff that would work out to be like $90 a visit. And that's, that happened to me. I'll tell a quick story about one of my first associates. She's great. She's still there. She, we were working together at our satellite practice. I was onboarding her. Of course, I'm 15 years in. She's 2 years in. She's taking longer. She doesn't have the patient relationships. She's being a perfectionist. I'm like, you can't be such a perfectionist about this PPO class 3. It's sealed. It has contact. I can't have you use 17 Soflex discs like dental school. And some of the patients were like, I won't use her real name, but she's awesome. So why is Dr. Katie taking so long? I go, you want to know why? She's doing a better job than me. She's trying harder. I don't try as hard as her. When I'm done, I say, get to goodish. When my thing's goodish with you, Millie, on your 18 occlusal, and Jason Smithson said this, he goes, I don't put in secondary anatomy on an 18 occlusal, but dental school makes their brain so mushified, Jennifer. She's now in private practice with me. We're taking PPO fees on a class 1 on number 19, and she's messing up the whole works by trying so hard. So I say, get to goodish, beyond clinically acceptable, get to goodish, and then you're done. If you have this magical time in the visit, you can do more. But if not, we're done. These people are 72. You know what dentists do all the time, Jennifer? They're very hypocritical. They try harder on other people than they would for themselves. Like if you were doing a filling on me, I'd be like, can you be done now, Jennifer? Like, no, I'm just trying to get the black Sulflex disc and disc. I'm like, we're done. So it's because of that dental school training that has blown up our brain and not taught us how to self-evaluate. And then when we're in the real world of PPO fees, the whole thing becomes a conflict.
Do you think part of what you just mentioned, I think one of the other big missing pieces of dental education, which by the way, I will have full disclosure, I don't know how you solve, is learning from failures. I actually saw that more in my residency than I did in dental school. And that was because you come in right after a year behind someone else. So you're usually following up or finishing their work and then moving on into your own train wrecks that you're going to create for someone else. And so I was learning through their mistakes, good or bad. And to be fair, that's not a criticism of that doctor. That was a learning environment for them as well, where they were pushing the envelope to do new procedures and techniques that they probably had not ever experienced before. But I was getting the benefit of their attempts by learning the things that were working and weren't working. But then I would making my own mistakes, I'm sure, and left that to someone else to learn. I feel like that's a big piece of the problem. When I left dental school, I thought I was a phenomenal dentist because none of my work had failed yet, right? I didn't see any of the longevity. My class 2s lasted for the time that I was there, which was not that long.
The problem with dental schools and GPRs, it's a time thing. First, I think, what you said is totally valid, but we're such a dramatic people. I would say the F word. We love saying a failure. Oh, the contour in your implant crown was a little off. That's a failure. So can we just learn from stuff that we wish went a little better, right?
Yep.
Learn from every single chef has put out a plate of pasta that's good that they wish was better, clinically acceptable, or if there's something, a lot of problems can just be solved with this weird thing. I don't know what you call it. It's money, right? So you could, like in my office, if an associate did a crown, for whatever reason, or one of us, the whole thing went sideways in a year, I'd give them all the money back. Redo it for free, right? Say, hey, this didn't work out as long as we had hoped. What we're going to do is just going to redo it at no cost to you, because dentistry is a living, breathing thing. It's a high contact sports in your mouth. So we don't really give ourselves the ability to say, we have this just great or stinks, which is like a Seinfeld joke. And they don't teach you to say, this is clinically acceptable. To make it better would be this. This is below clinically acceptable. You can't leave a crown that doesn't have contact, right? You can't leave it. So I just think it's a really good point you're making about how they teach it. But I think this is the point I want to make about dental schools, and I think it's the problem. But I do admire people who teach in a dental school. I did it for a year. I admire it. But this is it. I have a 4-year-old who lives in my house. She's insane, okay? She's awesome. She's annoying. She's aggravating. And I'm in all 4-year-old world. How old's your youngest, Jennifer?
7.
So you're close, right? But Chad's is in teenagers, right?
They're, teenage and college. And Jeff's are all out of the house. So totally different.
So if I ship my 4-year-old to Jeff or Chad, they would be crying for mercy in a day. I am strong. I know how to deal with her. But once she gets older, I'm not going to. So here's what happens. A 4-year-old is running a dental practice that never goes up. Every day, right? You and I joke, who's going to call out today? So when you're a practice owner, it's like having a 4-year-old that you're running every day. Some of it's great. You're proud. I mean, she says she dresses like Elsa. She's giving performances. That's great. She refuses to ever give up our phone if we let her use it for 5 minutes. That's aggravating. In dental school, we're often taught by people who had 4-year-olds 20 years ago or never had them at all. We're often taught by people who had practices many years ago or never had them at all. So their ability to practically teach us what you talked about is very limited.
So in your magic crystal ball, as you look at what the future of dentistry looks like, and I can already tell you, I mean, we haven't really talked a lot about the DSO amalgamation of what's happening in states and these conglomerates that are building up. But if you had a crystal ball to predict 10 years, 15 and 20, what dentistry looks like, let's hear it.
Oh yeah, I love this question, and I think it's fun, it's frustrating, it's poignant. If there's not some major changes at an early level of educating the future of our profession, it's going to get a lot more painful. This is going to look like the good times compared to what it's going to look like a decade from now. Here's why. I'm a big fan of Game of Thrones, so I feel like Jon Snow, he went beyond the wall, saw this whole world, and came back. That's my broker world, okay? I'll take some credit for creating a community that bonds people together. I cared about that. I'll take some credit for knowing about implants. I learned that. I take zero credit for learning about brokering until I did it, right? This is not me. I was in the broker world since 2016. The amount of people wanting to start DSOs, there's a new one that emails me every day. They got money. People are giving them money. Now, here's what happens. Rich people, some people, $10 million to them, Jennifer, is like $10 to us, right? So they're like, hey, here's $30 million, Jennifer, Paul, and Dinks. Go start your own DSO. Okay, go start. Buy us some practices. The whole thing goes kaput. That person might be like, that's like $30 loss to them. But it ruined people's practices and lives, right? So there's a lot of people getting into managing dental businesses. And I got to give Rob Montgomery, my podcast partner, Dental Focus Attorney, a lot of credit, because he's like, there's people who own tire chains who want to get into dentistry, and they don't know anything about dentistry. So they just assume a dentist is a dentist who's a dentist. So they're leaving a lot of young dentists on islands running these practices. So unless we get better information and core development skills, I talk about that, mind, words, hands, heart, to our newest colleagues so they can make better decisions. I just got an Instagram story, Jennifer, that got like 3 times as many views, okay? It was a screenshot of someone saying, I made a mistake. I didn't have a dental focus turn review my contract. This DSO in Florida is ruining my life. I don't know how to get out of there. And I got so many messages saying that happened to me too. One person guessed the DSO. I try to remember. One person goes, is this Guac DSO? I go, yes. How'd you know? He goes, that sounds like what they do. So my prediction is, unless we get core development skills beyond the Krebs cycle to our newest colleagues, it's going to get more painful, because the older dentists, this is hard, there being a lot of money put in front of them, which could be hard for any of us to turn down, right? So I'm sure I'm doing something today in Philadelphia, Jennifer, that's polluting the earth for someone 50 years from now. I don't care. So if you say to a 55-year-old, I'll give you 150% of collections for your practice, you think they're going to say, I'd rather wait for a young dentist to buy it for 70%. So I think my prediction is we need to get everybody paying attention to how this game is being played and navigating it with core development skills of business, communication, bonding together, looking out for each other. Doesn't mean all DSOs are bad, but I believe that private practice ownership is on a path to continuing to be shrinkified, because the DSOs are coming in with money that just cannot be competed with at a private practice buyer level.
I would go in addition with that and say there's the consumer buy-in as well on this particular piece. Yeah. And I think consumers are going to go farther in the hole of the commodity perspective of dentistry before they realize and really feel the pain and suffering that comes along with devaluing dentistry to a commodity level as opposed to healthcare. My long-term prediction is we go into this downward curve, both as professionals and as consumers of healthcare in general. And then there's going to be this pendulum shift where the consumers are going to push and drive and desire to want qualified healthcare providers providing comprehensive healthcare. And that's not going to be within the DSO world. It's going to go back to private practice. I think it's going to be this interesting, an interesting curve.
I want to add to that because I think it's really, but I'll use a story to share that. I went for our anniversary with Mary to this place, Her Supper Club in Philadelphia. It's run by a chef named Amanda. She's one of the best chefs on earth. She runs this little place. She explains the food. Probably costs like $125 for everyone to eat there. And then the next day at Nacho headquarters, I go to Chipotle. And I like Chipotle, right? And I get a $12 burrito. And I totally know the difference between that $12 burrito, which is acceptable, right? No judgment, and the $125 meal I ate at her supper club in Philadelphia, okay? In 2004, I sat at the Hinman Dental Conference, and one of my favorite people on earth said this to the 300 people. 2004 said, if dentists cannot start explaining to the patients the difference between a $600 and $1,200 crown, we are in for a world of hurt. And the person who said that 18 years ago was Dr. John Coyce. And he said, this is what's going to happen. And we're here, Jennifer. And I believe you in that we're going to have this group of practitioners that can deliver services at a high level and have it valued. But how do they get trained to do that? And are there enough of those business models for these 6,000 dental students graduating a year?
Well, and how much more are they going to have to invest in becoming highly competent dentists outside of, I mean, I look at my own career path and I had my dental school education costs, but then I invested well over $100,000 of additional postgraduate education at Coyce, doing these deep dives in lots of areas so I could feel very comfortable with 95% of the things that walk through the front door. Maybe I didn't treat them all, but I at least knew and understood the majority of it. If I were a dental student today with the monkey on my back of a $500,000 debt load, then having to digest the idea that I'm gonna have to spend another $120,000, $150,000 to actually get to the level of competency that I think I deserve and should desire, I don't know how you, I don't know how you consume that. I don't know how you get to a healthy mental space to say, yep, that's logical. That makes sense to me.
You and I speak the same language, and I was just kindly annoying one of my favorite persons to sign up for one of our products for $500. And he said, Paul, I just signed up for a $7,000 C course. I said, I'm proud of you. Sign up for this one so you know how to talk to the patients about that stuff. But their brain is, and I totally get it, because if you spent $500,000, and I know it's loaned to you, and now someone said you got to spend another $50,000, it's a very, very difficult thing to do. And it's something that it's very hard for us to understand where they are in the empathy way, and the putting ourselves in their fig scrubs, right? Scrubs were better. Scrubs are better now, Jim. You know what our scrubs are made of? Cardboard. Oh. Cardboard. I wore cardboard. Now you can wear your scrubs out to a club, but they got that.
Yeah, totally.
We were in their fig scrubs, which we didn't have. So I think you are doing just an awesome job kind of highlighting in an authentic way. You know, I did say this to one young dentist as we wrap up. Sometimes people send me these messages and I'm like, just call me. Like, I'm at Nacho headquarters. I'll talk to you. Call my personal cell. I'll give you 12 minutes, right? And this happened to a young associate. Paul, I, took this job. It was a terrible job. I moved here. I said, I'm going to give you advice now. And I don't want you to go cry and do nothing, but I want you to be concerned for the next time. So that's the hard part of teaching younger people stuff. If you come down too hard, they cry and sit in a corner. It's happened to all of us. Give up. I'll never lose weight. I'll never be good enough. You want them to be responsibly concerned. And I said, never sign a contract again without a dental focused attorney reviewing it. And if you don't have the money, ask someone for the money. Because the fact that you didn't spend $750 to protect your $500,000 career was a really problematic mistake. And you cost yourself more than that. They just need more of that, cliche tough love from the older dentists where we care about you, but this is what you need to prevent these problems from happening again.
So when I interviewed Dr. Smithson a few months ago, I said, okay, top 3 pieces of advice as we close out today. In his world of direct composite dentistry and aesthetic dentistry, and he had a few key poignant top 3 statements that he wanted to share as kind of a close. And, I'd love if you could provide our listeners with just if you learned nothing else from this particular discussion, what would be the 3 key takeaways?
I love this point. I love kind of putting these snaps. ABC to FLA, always be connecting to feel less alone. Dentistry is a very lonely place, even when you're surrounded by people. And connect with people in your local community and bigger community. Go to more in-person see than you think and meet people. It's for 2 reasons. 1, so your morale gets better, but 2, these relationships are magical and someone's going to tell you, oh yeah, my roommate from dental school is selling their $1 million practice. If you show up in the room where it happens, like from Hamilton, magic will happen. ABC to FLA, feel less alone. The true opportunity that new dentists have is the access to information we didn't have, especially on this dreaded word of sales. And the reason why I got up every day and love selling things to my patients and Nacho people is because I think if it doesn't help, it doesn't matter. So what I'm doing is helping. Implant overdenture gen, course on how to talk to patients. Once what you're doing is helping, be proud to sell it. So you can listen to podcasts and training inside and outside of dentistry, so that when you sit next to a patient, you can confidently have uncomfortable conversations about that. And the third thing is, embrace the LLLs. We all can learn together, laugh together to do that magical thing, be less annoyed together. No one really likes the dentist, Jennifer, so we might as well like each other. So that is my final message to you here.
Paul, thank you so much for joining us. Let's remind everybody where they can find you. Obviously, your very popular Dental Nachos group, but also don't forget, he runs a brokering opportunity as well through Dentist Job Connect. If you haven't reached out and you're either looking to bring on associates, or you are an associate looking to find that perfect match, why would you not bring anyone else on the team but Dr. Goodman? I can't think of a better reason. Can you?
Thanks. I appreciate it. I mean, that's my thing, it's the Dentist Job Connect. I do all these things, Jennifer, which I love, be nicer to people, learn about composites. But this Dentist Job Connect thing has just brought so many people go, I need that help. I got too many hygiene patients. I need to this. My wife says, if I don't stop working 6 days a week, it's going to be a problem. So dentistjobconnect.com, proud to be a sponsor. We make it fun. We make it affordable. We lay in responsible information. And I'm really proud to be bonding dentists together with that.
Well, it's kind of like treating sleep apnea in my practice. Like, that's the one thing other than an oral cancer screen that actually will change the trajectory of someone's life forever. And I think Dentist Job Connect and putting good people with other good people so that they can enjoy the job that they're doing every day and grow professionally and personally, that's better than most Class 2s will ever do. So thanks so much for everything you're doing for dentists, and honestly for dentists in the know as well.
Thanks, Jennifer.
Have a great day.
You too.
And we'll end there. Great job.
Yeah, that was fun. It flew by. That was great. You're a great interviewer. Let me know when that comes out. I'll share it with people. I'll send it out. I'll send you the one I did with Mark Costas. You should guys have Mark Costas on your podcast. I was
going to say, I think that's definitely one we need to get on as well, for sure.
Yeah, he's awesome. I mean, I was just on his the other day. We were talking about a lot of these things, and that's what we talked about. I have a few extra minutes. Like, he kind of brought it out. I made the Instagram post, and he was like, this is so on point. He's like, why do these places? He's like, he was doing his Mark Costas math. Like, if you have like 100 students a class at $100,000, just 100 students a class, you got like $40 million in those 4 classes. Why do you need Pacific Dental Services or Heartland to brand their clinic? I mean, I said, listen, I am all for people who are 25 being able to drink alcohol, but not people who are 5, right? They don't know. For a 30-year-old eating a bag of Doritos watching Netflix, but I'm not all for my 4-year-old because that's going to contaminate what's this. So if my 4-year-old had the Doritos Learning Center at her preschool, I'd be like, this is not okay.
No.
So,
and I didn't want to say, because I didn't want to get too political, but it's just like this loan repayment program that just came out is another brilliant move. All these schools, dental schools included, are sitting on these massive endowments of money. Right. And instead of actually looking at the real problem is that education in general has become so cost restrictive that the average person, even if they could afford it, will choose not to pay for that because the ROI is not there. And instead we're going to say, no, schools, you're fine. You keep charging these stupid prices that you're charging because it's obviously really smart to pay $400,000 for a basket weaving degree. We're just going to wipe the debt and have hardworking folks pay for that poor decision-making paradigm on everybody's part. And I mean,
they cause the problem and they become the judge and jury on fixing the problem.
Correct.
And then they make other people in the arena question their sanity. Right. It's like,
and cough up money to say, you know what? And guys, we're going to ask you to go ahead and pay, like, your tax dollars are now just going to pay to continue to allow us to make poor choices.
They need to go back. I was just at my Vistas group, and one of the guys does this very cool high technical work where they hire people from technical institutes starting out at $20 an hour. They have such competition. Every one of those students is accounted for after graduation. The first month they go to these schools. And if they stick with those jobs, they go from 40 to 60 to 80. And I think that's what we need to do instead of these pretend degrees that no one can use after they're done. And we just got to be real about it, right? Because this guy's creating jobs that were tangible stuff. They're making things, right?
Yeah. And they can go on and own their own company, running more individual. I mean, like the ability, their earned income potential is higher than ours because we're so restricted by, you know, number one, cost of ownership is so high, the overhead is so high. And then if you dare throw in PPO compression into that, and then that's, you know, between you and I, that's my biggest fear is smart people will stop going to dental school. Like really competent business people will look at the dollars and cents of all that. And we'll get plenty of really smart people who are very academic and could read their way through a giant textbook like nobody's business, but real business people who can do dentistry and also communicate and talk to people. I'm afraid they would look at the dollars and cents of that decision and go, I can just go to corporate America and in 3 or 4 years be chief marketing of this particular area and make 4x what I could make in dental school and not have the debt.
I do, like, one day I'll talk to you guys more about my dental nachos world. Like, I'm in this startup world, right? So I'm kind of the founder that has to risk the life savings, and I'm kind of making right. But some of the people who work for me have grown up with me and are doing well, working for a company that came from the thoughts in my head, working for a company where we hang out with swag all day. And yes, there's intensity, there's definite intensity, but like they are growing, you know, the Brandon Hills of my organization and stuff. And I'm creating this entrepreneurial world where people can join people like me and like have this different trajectory. And there's no debt to be part of my team.
No, there's no risk for them at all.
Right. So it's like, you know, that's I think, you know, dentistry needs a tremendous rebrand. You guys are doing great. I got to go too, but this is awesome, Jennifer. Let me know when it comes out and I'll be sharing it everywhere.
I'll see you in a couple weeks.
Yeah, awesome. Thanks for doing this. I appreciate it. Talk to you soon.
Bye.